I just want to take a moment to say I hope everyone is staying safe amidst this global pandemic. But my name is Michael Wilson. I'm a senior, and this is my senior project presentation over healthcare disparities for refugees in the state of Idaho. But before we begin, I want to go back in time. The year is 1933, and at this time, across the world, Adolf Hitler has risen to power. He's put laws into place preventing Jewish people from holding office or from teaching at universities. And unfortunately, for one Jewish German professor, he knew that he couldn't return home. At the time, he was out of Germany, and he ended up going to England as an immigrant before coming to America as a refugee. This man was a brilliant scientist and would go on to get a Nobel Prize and has since reshaped the way we think about science and about physics. While here, he contacted FDR and told him that we needed a better system for refugees. This man is none other than Albert Einstein. The organization that he helped create is the International Rescue Committee. Einstein once said that the significant problems we face cannot be solved at the same level of thinking when we created them. Think about all the problems in the world, the difficult solutions they might have. Refugee healthcare and its solutions might end up having some of those different ways of thinking. But who am I? My name is Michael Wilson. I'm a senior at Meridian Medical Arts Charter High School. I'm a nationally certified EMT, and I'm currently enrolled in a CNA course and a Pharm Tech course, where I will hopefully work as a ER tech throughout college, where I plan on going to school at the College of Idaho, doing a double major in biomedical science and Spanish, and a minor in anthrosoc. But most importantly, I'm a volunteer at the International Rescue Committee as an assistant medical caseworker because refugees are important to me. I'm an ethnic minority, I'm a mixed race background, and so when I first started researching ideas for my project, I wanted something that was going to be impactful to me. And refugees and minorities are important to me, which leads me to where I am now. But what is a refugee? In 1951, there was a convention associated with the Geneva Convention, but it really was its own thing, denoting the status of refugees. It outlines the protocol for how to treat refugees and how to process them. And it defined refugees more or less as any person that cannot return to their country of origin for fear of persecution against their person, whether that be for their nationality or their ethnic background or their socioeconomic status. So what is the refugee process like in Idaho and in America? It's difficult. It takes anywhere from 18 months to, it can be a little over 2 years. And it's a process. So a refugee might start out in a refugee camp like this after they've left their home. You can see that the conditions aren't good. And so during this time, they go through a registration where they give all their demographics. They're going to go through a security check. They're going to do 2 interviews through the Department of Homeland Security, and they are going to have a biometric security scan just before they even come to the country. Provided they get in, they're going to have a cultural orientation and a medical screening, just for our safety, to know what they might have and how best to treat them. And then they're going to be assigned maybe to a state like California, or perhaps even a place like Idaho. But there is some problems with our system. One person becomes displaced every 2 seconds, as according to the United Nations High Commissioner for Refugees. This is a humanitarian crisis. 70.8 million people were displaced from their country as of 2018. almost 26 million are considered refugees. In addition, the United States was a leader in refugee healthcare policy up until 2017, where we were admitting the most number of refugees compared to any other country in the world. And as you can see, so the blue line is our annual ceiling, the purple line is our number of admitted refugees, and as time goes on, we kind of plateau and then we drop. And now we are one of the worst countries for refugee admittance. Idaho is in the top 20% of refugee admittance per capita, and that is amazing. In addition, Boise is one of 17 certified cities throughout the United States that is a welcoming place for refugees, which is huge. It shows that there's progress being made. However, there are three major problems with our refugee healthcare system. The first being refugee law. In the United States, refugees are given 8 months of healthcare access through what is called RMA under a larger act called the Cash and Medical Assistance Act, which reimburses states 100% for any administrative costs or the actual costs it takes to harbor refugees. And as part of that, there's RMA, which gives refugees, as I said, 8 months of healthcare through Medicaid, which is huge. However, there's some problems. Once those 8 months end, 49% of refugees will become uninsured. And after those 8 months, refugees must find out how to go about getting the health care they need. And typically they're doing it alone. The second biggest problem is transportation and use of services. Refugees are a lot less likely to utilize healthcare services. There was a demographic study done by a doctor from UCLA that was published in the Journal of Immigration and Minority Health. Dr. Guess and her team went through and they looked at the rates at which refugees used different healthcare facilities as compared to immigrants and Americans, American citizens. And they found that refugees are a lot less likely to use those services and use them correctly because of lack of education. Many refugees don't know when to go to an emergency room versus when to go to primary care facility because the system might be different in their home country, where there might just be one clinic you go for anything from a broken bone to just being sick. And so often refugees might go to an emergency room because they have a cold, or they might go to like a primary practice facility and might have like a broken bone or something. And that's a problem because it slows down our system, but also it's difficult for them because they don't know how to navigate this system because they haven't been taught. In addition, there are language barriers. 72% of refugees are functionally illiterate, as according to Jason Richwine, a PhD and a public policy analysis for the Center of Immigration Studies. And he looked at the literacy rates amongst refugees when they come in and found that almost 3/4 of them cannot adequately comprehend or speak the English language, which is a huge problem for anything because how can we expect them to be able to adequately go to appointments and be able to do things if they can't even fully speak the language? In addition, there's a system called the Medical Transportation Management, MTM, transportation system for refugees to help them get to the appointments they need. The problem with this is that it's only for non-emergency medical transportation. So refugees have 2 preliminary screenings they need to go to. And they have to schedule an appointment, and often taxis will take them. because MTM can be difficult to use and unreliable, because if you're dealing with language barriers, it can be very difficult to actually get to an appointment and to call and schedule your own appointment. Furthermore, healthcare access is the third biggest problem in regards to refugee healthcare, because many healthcare providers don't know how to help refugees. They might have a condition, or for many women, genital mutilation, unfortunately, is a huge problem, and that's not something we see in America. And so our doctors aren't taught how to deal with these things. We aren't given the cultural competency to help treat refugees as humanely and as adequately as they deserve. And that's a huge problem. In addition, providers are a lot less likely to accept that Medicaid that refugees might get. For some of them, they might have specialized conditions. They might need to go to an optometrist. And 31% of physicians don't accept Medicaid patients. That means that only 2/3 of the clinics will be available, and most will just be standard hospitals or emergency rooms, because private clinics don't like dealing with Medicaid. In addition, translators are expensive, which creates a barrier in its own right. Right, as if 72% of refugees are functionally illiterate, there needs to be some kind of way for a provider to communicate with them efficiently. And translators can be difficult to deal with. And so a lot of the times, refugees might not have access to one. And so if a refugee doesn't have access to a translator, how are you able to adequately provide the treatment they need? You can't. And in addition, there's many healthcare conditions. I listed genital mutilation, but hypertension from stress, and nutritional deficiencies. Maybe they're coming from a small village in Africa that's coming from a place of war, and there isn't a lot of food. That's a problem, and that's something that we as providers need to be able to understand and be able to help. And then mental health disorders, PTSD, depression, are huge things. A lot of refugees might come in, and like things like 4th of July are terrible because they hear our fireworks go off, and it reminds them of bombs from any war that they might have endured in their home country. And so I went through, and since September, I've slowly been researching the ins and outs of refugee healthcare here in Idaho, and found just some of the problems. I already listed the 3 biggest problems, but I did some research on my own. I interviewed a doctor at the VA, Andrea Christopher, who was a specialist in disparaged populations. And I also interviewed a master's social worker at Tidwell Social Work, to gain both of their insights on what's kind of working and what needs to be improved. And I'm just going to share one of the many quotes I gathered. And this was from Maja Maki, who is this social worker that I talked to. And she said that I would say that the biggest barrier for treatment is the time frame put on newly arrived refugees. And with Medicaid expansion, that helps a bit, but people are still falling through the cracks. You think about that, 8 months. 8 months to get situated in a new country, to be able to go and live a life and go to your appointments and have a job. It's very difficult, especially when you might not speak the language, and then all of a sudden it's, oh hey, there's 8 months, and then you're on your own. It's very difficult. And so as I talked with them, in addition to the volunteer work I did, I gathered that there's really 2 paths a refugee can take in regards to the healthcare access they get when RMA ends. And so they start as a newly arrived refugee, and then they get their 8 months of Medicaid. They're either going to be Medicaid or CHIP for children, CHIP eligible. And if so, they're going to get continued Medicaid through the government. However, they aren't eligible for either of those. Their coverage just flat out ends, and that is a huge problem. They either will get insurance through some private association, or maybe through their work, or they might be given some subsidized health care if they fall below poverty line, either 100% or 400% below the poverty line, in that range. If they don't have insurance, they have two options. They can go to an emergency room where they can't be denied treatment based on inability to pay through EMTALA. Or there's community health clinics with sliding scales that help with people that might not be able to pay. But that leads us to what is currently being done. We have organizations that are humanitarian based, Agency for New Americans, International Rescue Committee, and Janus, just to list a few. And those are the three big ones here in Idaho. But beyond that, there's not a lot to help refugees as they go through the resettlement process. In addition, there's health centers. There's the FMRI, Family Medicine Residency of Idaho, which is a sliding scale factor that helps refugees with their preliminary screenings and that kind of stuff, and that is amazing. Same with St. Alphonsus International Clinic. Same sort of thing where it's given a sliding scale. Through Janus, there's Genesis Community Health, which provides some dental work. I've done some volunteer work there in the past, and that is another great resource. And then Tidwell Social Work is primarily for refugees and refugee healthcare conditions they might have, and that's a big one. But clearly there are still some solutions, right? Like that 8 months, that's our problem, and it's the biggest hassle and so difficult to work with. But there are some solutions. One, we can expand that RMA time frame, probably somewhere from 8 months to 2 years, realistically, would be the best thing, because it would allow them the smoothest transition possible. And it would allow them to gain a lot more services for understanding maybe their own conditions, and be able to get access to a translator. In addition, we can help educate providers. Cultural competency is something that's kind of talked about with providers, but it's not emphasized. It's like one chapter in a book where it's like, oh, this is how you might deal with it, but it's not in depth enough, and it really doesn't prepare you for anything you could see out in the field or out in a hospital setting. And so that's something that can be improved. In addition, a more reliable transport system, because if MTM fails, organizations like the International Rescue Committee or like Janus, and trying to get people to these appointments, they're left with the option of, hey, we're going to schedule you a lift to get you to your appointments. And that's just time, it's money, and it's just inefficient. There are ways it can definitely be improved. And for civilians, beyond this, what can we do? We can help spread kindness and help refugees feel as welcome as possible. And that's really all we can do, because the biggest thing is expanding RMA. But I want you all to think about that quote from Einstein. Think about all the solutions that there are to solve a problem that affects so many. And war, it's a difficult conflict, but refugee healthcare is something that is desperately needed, and something that we cannot continue to fail to provide for refugees. And it might have some complicated solutions, and some solutions like going out and just talking to them. It can be simple, and it's important. But I just want to say thank you. If you have any questions, comments, you can leave them in the comment section below. Thank you.